Healthcare professionals of Reddit, what is the most surprising thing that your patients don't know about their own health? EMT on a rural service, the bulk of our calls can be avoided if you just take your meds like you're supposed to. Also, if you're a diabetic, freaking eat something, stop skipping meals and calling us because you're dizzy. Stop skipping meals and calling us because you're dizzy. Whoa, I guess a lot of professions suffer from the same crap us in IT deal with. Scary stuff. Allergies to meds. I can't count the number of points I've asked are there any medications you're allergic to and they can't answer it. They either don't know the difference between an allergy and a side effect, or don't know the name of the medication they're allergic to, and don't bother to wear a medical alert bracelet or anything. It's almost like they don't care. I do a HIV and syphilis study and it's so surprising how many people don't think you can get STDs from oral sex. They wrap it up for sex yet don't think twice about giving and receiving oral sex unprotected. I had a county health professional try telling me that during a presentation. He also went on to say that you couldn't get STDs from anal sex. My brain just about imploded. I have conversations like this daily. Me, I'd like to go over your medical history with you. It says here you have a history of high blood pressure. Patient, no, that's wrong. Me, okay, I see on your medication list that you take hydralazine. What do you take that for? Patient, for my blood pressure. I used to have high blood pressure but it's okay now. Fasipam. I get this all the time, but if you think like the PT, the problem with their blood pressure has been addressed, so it's no longer a problem. I learned very early in school that how you phrase a question makes a huge difference in the quality of the answer you get, and it's not necessarily the fault of the PT. That you have to take your medicine for it to work. Also, if you feel or get better with medicine, it doesn't mean you can stop taking it. You feel better because of it. Ugh. This reminds me of the latest chapter in the saga of my idiot cousin. Divorced, 2 children, joint custody. He refuses to give his son his seizure medication because he doesn't have them when he's with me. Words cannot express how sorry I feel for those kids being raised by the mental midgets they call parents. Pharmacist here. The lack of dialogue between patient and provider is always concerning to me and it can have pretty far-reaching consequences. I've seen people make the decision to have surgery or a painful, invasive test performed that really is unnecessary but they trust the doctor so they do it no questions asked. You or someone you trust should spend at least a couple minutes going over every detail of every procedure before it's done. You should know why it's being performed, how it will help them care for you, and what the risks are for the procedure. The biggest issue I see a lot is spinal taps for infants. So many are performed and their utility is starting to become highly questionable. In terms of my profession, pharmacy, I am always astounded that people don't know what medications they're on and why they are on them. When I have people that don't know they're on blood thinners or blood pressure medications, it boggles my mind. I strongly encourage everyone taking their meds to keep a list of them plus allergies, major surgeries, and all your doctors at all times and to update it regularly. Encourage your parents and grandparents to do the same thing. Help them if they need it. It is amazing the amount of errors and delays in therapy that can occur simply because of poor history. I'm a pharmacist and have seen some pretty interesting patient logic scenarios, but I think some of my favorite include antibiotics. On more than one occasion I've had patients put a capsule into their child's ear canal for an ear infection. Teacher here, so I am not a medical professional, but seriously, your kid needs sleep. If they are tired, let them sleep. Don't drag them around at midnight because that's when your check came in. They should be in bed. This makes me sad. The staggering amount of ignorance that people have about the effects of their obesity. I work in an orthopedics office, and almost every day we have patients who come and saying things like my knees hurt because of my anemia or the cartilage in my knees is worn out because I don't take my vitamins. No, you're 325 plus pounds and the joints in your body are not equipped to handle that. And somehow these people completely lack the self-awareness to see it. I used to work on a geriatric ward. 9/10 people on DNR orders were not aware that they are on DNR orders. I used to work on a geriatric ward too. 9/10 people were simply no longer aware. I work at a rehab hospital where the goal is for the majority of patients is to return back to their lives after sickness. surgery, or illness. Usually the first 5 days at the hospital seems to be the hardest because they just left the hospital. But after about a week the therapists, physical, occupational, speech, recreational, etc. really start working hard with these people to help them get back on their feet. However, there always seems to be this handful of patients that flat out refuse to participate. All they want to do is lay in bed and won't even attempt to get out of bed to relieve themselves. Or even better, not even try to use a bedside commode or bedpan. Just lay in bed and pee and poop themselves all day long. And then call someone to clean them up, being fully aware that they prefer to crap themselves and have some clean them, instead of using the multitude of options we have to help relieve themselves. The kicker is, most of the people who do these things are patients before their health decline, lived independently, drove, held a job full time, have children at home, etc. Let me add that because of their lack of participation in the rehab programs or their lack of self-care, we can't discharge these patients to their homes and instead may have to extend their rehab in a long-term care setting. And their families come to me and beg and cry and complain about their family members' lack of care and how they're just not improving. And they just cannot understand. So and so family member must be so sick that they cannot even use the bathroom. You should always check the color of your poop. You should also remember if you ate beets or not. Juice is not good for you. It's pretty much just sugar. I've seen tons of diabetics trying to be healthy by replacing all their soft drinks with juice. As dentist, I can understand that diagnosing decay may be difficult. Examining yourself in a mirror is difficult. But what drives me crazy is when points come asking for whitening and be shocked when they are told that the hole in their front tooth is cavity. It's like your front tooth has a freaking black hole in it. What could that possibly be? And how did you not think that something was wrong? Being overweight is bad for you. It might not be really affecting you right now, but it will. Being a normal weight isn't just for aesthetics. On top of that, people who don't care about what they're eating. Even if you are thin normal weight, you won't be healthy if you're living on fatty, sugary foods. Even if you're only taking in a certain number of calories per day and not gaining weight, you're missing out on a lot of nutritional value. The second thing is so true. You would think my sister was a land beast weighing well over 400 pounds when you look at her blood pressure, cholesterol, and triglyceride levels are through the roof. She has little to no muscle tone and basically lays around the house all day. She only eats junk food, carbs, and sweets. My mother sees this as okay since she is thin. Old man strength. I work in a long-term care facility, and god dang, these old men who sit around doing nothing but being crazy all of a sudden wake up and literally toss a wheelchair out a window or flip some tables. It takes like 8 people to restrain them. Old man strength is real, it's scary. Contacts and glasses are prescriptions. You can't just come in with an empty box of contacts and demand I need to sell you more. The curve and diameter of your eye are taken into account, and you can hurt your eye if you're using the wrong ones. If your eye doctor recommends that you see a specialist for glaucoma, cataracts, or something else, go to the dang specialist. Do you want to be blind? No, you probably don't. Well, to be fair, I'm pretty sure the boxes often have that information on them. That said, I'm not going to be one of the people walking in with no appointment demanding my contacts. I work as an RN at a dialysis clinic. At this point in the USA from 1980 to 2009, ESRD, end-stage renal disease, has increased nearly 600%, from 290 to 1,738 cases per million. This is due to the fact that many Americans have little to no interest in eating a healthy diet, taking medications as prescribed, or exercising. The two main causes of ESRD are diabetes and high blood pressure. People, make sure you take care of your bodies, because you do not want to be in the situation my patients are in. As a veterinarian, my patients don't even know about the concept of their own mortality. As a farm tech, I can tell you that 90% of the patients have no clue what they're getting or what it's for. I get multiple scripts all the time where they just say, "Can you tell me what the doctor prescribed me and what it's for?" Either doctors aren't explaining anything or patients aren't listening. Also, a surprising amount of young adults and adults have a very limited idea of a lot of sex-related things. I get a ton of questions about birth control, the Plan B pill, condoms, and their STD medications. I always love the I just started taking these pills for my insert vaginal bacterial infection, so I can still have sex, right? No, you should probably wait until you've cleared your medication regimen, and then some lol. How bad eating badly can be for your health. People are shocked when they hear they need to change their diets or stop smoking. My mom is in pediatrics and it's appalling how stupid some of the parents are. I used to answer phones for her, take messages and such. One parent called in worried that her child was having an allergic reaction to something that necessitated an immediate callback. This is how that call went. Hi, this is Dr. Blackazin's mom. What's going on? Oh well, little Johnny was eating a little while ago and when I came back he had this big rash on his face. It's all red around his mouth. What was he eating? Strawberries. Is he allergic to strawberries? Number. Why don't you try wiping his face? She presumably wipes child's face. Oh gosh, it was just strawberry juice on his face. I'm so sorry to bother you. WTF. I can easily see that happening to an otherwise intelligent person, especially if it's their first kid in less than 2 years old. All of us have periodic flashes of stupidity, especially while tired and stressed, and people freak out about their children's health. Let's see among us who has never waited over a minute for a stop sign to turn green cast the first stone. Wash your freaking hands, and that means you medical professionals. Don't know about other places, but in the UK there is a hand washing station every 20 steps you take in most hospitals. Not necessarily about their own health, but I had a patient come in who was very angry that she was pregnant despite being on a contraceptive. After talking to her for a few minutes, I found out that she had been taking her NuvaRing, cutting it up into 30 pieces, and swallowing 1 piece a day. I have also had a patient wear it as a bracelet. She had been taking her NuvaRing, cutting it up into 30 pieces, and swallowing 1 piece a day. What? My friend didn't know you could pee with a tampon in until the day before her 25th birthday. I wish I was kidding. A woman came in our clinic for a complete checkup as a requirement because she is going to work in another country. One of the requirements was an HIV test. While I was taking her blood she asked me, is HIV still a thing? WTF. Most do not know how normal they are. Your grandmother may or may not have died painlessly. If there are no obvious signs of struggle suffering, I, and everyone I know, tell the family the patient died painlessly. That sex makes you pregnant. Oh, I didn't know I wasn't supposed to take my wife's nitroglycerine medication whenever I had chest pain. She's my wife, so I know that the prescription is for both of us. Yes, they were old. In the UK at least, legal doesn't mean safe. So many deaths caused by people taking legal highs. They assume that if a substance isn't banned yet, it's safe to get high off it. In reality, some real-life Walter White has changed the molecular structure of some pretty nasty class A drugs and redefined them as plant food so that they are technically legal. Cannabis users, on the other hand, are criminals in the government's eyes, but that's an argument for a different forum. That antibiotics should be taken for the full course. Yay. That bad yeast infection that I have to now monitor intake cultures from is due to the fact that you stopped your antibiotics, kept the leftovers, and diagnosed yourself when you felt that you had the same sort of infection again. Yay, don't do that. Take all your prescribed antibiotics. And don't come in begging for antibiotics for a cold. And when we don't give them to you, don't call me the next day saying that you don't feel any better. Your cold can hang on for a very long time, so call after a week or so. We are not concerned about pneumonia until you've been coughing for 4 weeks. If you're coughing, it's not strep. That things like heart disease and diabetes don't give you a little warning flare when they are still far off. It seems like so many people have a history of these diseases in their family, have bad diets, have bad routines, but feel that they will have plenty of time to change their behavior when they have to. They don't have to think about it now. That somehow, they will get some sort of message and then will be able to change their behavior when the time comes, and that's no problem. You have been visited by Angry Doggo. Comment, calm down papa, to enjoy a life full of peace and harmony. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day you magnificent people.